Okay, well, it is just now 10 o'clock. We will go ahead and get started. We do have a special guest from our behavioral health team joining us today. When she chimes in, we will stop our presentation where we're at and let her talk to us a bit about some really helpful information for all of you. And we appreciate your time. Thank you so much for joining us. My name is Denise Gruden, and I am the Medicare Sales Executive with Western Health Advantage. Today, I am joined by my colleague, Michelle LaHuda. She is our Director of Government Programs.
So again, good morning. And as I mentioned, we're talking about behavioral health through Magellan Behavioral Health today. As you all know, Western Health Advantage is an HMO, and typically when you need to see a specialist, for example, like a cardiologist or a podiatrist, your primary care physician or PCP provides you a referral to see that specialist. When you need to seek behavioral health benefit services, you do not need a referral from your primary care physician. You have direct access to a Magellan Health provider. And there are a variety of licensed providers depending on what type of situation you're experiencing, and you have options for how you access that care, either through in-person or virtual visits. So speaking of virtual visits, also known as telehealth, there are many advantages to scheduling a phone or video appointment versus waiting to make an in-person appointment. For example, sometimes there's a little more flexibility with appointment times that gets you access a little quicker to a provider. And then of course you're not having to drive your car, you're eliminating parking, potentially, especially if you're seeing a physician provider downtown. And like in-person visits, the telehealth visits are completely confidential. And probably the most important thing to take away is that the copayment, either $20 on your MyCare Plus or $25 on your MyCare plan, the copayment is the same whether it's in the office with the Magellan Health provider or whether you're having a telehealth visit. So there's nothing to discourage you financially from accessing your behavioral health through telehealth. So what type of services are telehealth? So it can include inpatient care at a hospital. It can include outpatient care at a treatment center. It includes mental health evaluations and office visits. And all the care is managed by Magellan care managers whose sole purpose is to assess your situation and ensure that you receive the type of assistance or care required to help relieve you of your concerns or resolve the issue that you're experiencing at that time. We're all aware of the impact that our mental health can have on our physical health, whether that's positively a positive impact or a negative impact. Therefore, we encourage you, if you are experiencing a behavioral health moment, that you're not shy about communicating that with your medical provider, your primary care, because it's important that your care is coordinated. You want to be treated as the whole person.
Thank you so much.
Hi, everyone. This is Lisa Ciaconti, Western Health Advantage's Marketing Manager. It's my pleasure to introduce Dr. Parmely, Dr. Stephanie Parmely. She's a psychologist with Mercy Medical Group in Folsom. She's a very busy lady. She is fantastic. She's been featured in SAC Magazine and online blogs. And she is going to talk to us today about coping with COVID isolation, because we all are dealing with that. So we thought that would be a very timely topic for her to share with you today. So Dr. Parmely, take it away.
Hello, everybody. I apologize that I can't hear anybody, but I can see my chat. So if somebody has questions, go ahead and let me know. So I'm going to go ahead and proceed. Basically, we're going to be talking today about coping with isolation during COVID. And I have talked with a lot of patients through this time about this topic. I know it's very challenging for everybody, and that is the one thing that I think is important for all of us, is that we are all in this together. It's our collective equivalent of a world war, but it's a viral war. And so I think I want to start with the importance of validation, whether that be through somebody that you get validation from, or whether you validate yourself. And really, there's an importance to validation. Validation is basically reinforcing or mirroring, kind of giving yourself active listening and saying to yourself, I know this is hard on me. I know this makes me anxious or makes me depressed. Whenever we get validation, whether it is from somebody else or we validate ourselves, our brains feel that mirroring. We have mirror neurons in our brain. And when we feel that from other people, our brains produce dopamine and serotonin, which are the feel-good neurotransmitters. And so it's important that we validate ourselves whenever possible to help with that. The other thing that's important is knowing that when we don't fight ourselves for what we should be doing or what we're not doing enough of, it reduces anxiety and depression. So basically, when we feel down, whether it's depression, anxiety, or something else, and we get upset and we overthink and we try to talk ourselves out of it or say we shouldn't be feeling this way, what should I be doing different? All of those things produce resistance in our brain, which increases the anxiety and depression. So it's almost like steering into a curve when your car starts to glide on ice or water. When we all learned driver's ed, we learned that we shouldn't turn away from the spin, we should turn into it. It reduces the resistance and helps us gain control. And the same is true for ourselves. So I think with all this going on, it's really important to validate and not resist our own frustrations, but to lean into them. Okay, thank you. Can you go to the next slide? One of the big things for helping us all deal with the isolation during this time is reminding ourselves that we're building resilience. Any challenge that we go through helps build our resilience. Now, I don't get a chance to see all the people on this call, but I'm going to assume that a lot of you have been through a lot already. You've already been through very tough times, and every single challenge you've been through, even if it's left scars, even if it's affected you, it has also built resilience. And every time we deal with adversity, our brains are learning coping skills for dealing with that challenge. So talking about emotional resilience, basically they're attitudes and behaviors that help us deal with significant life stress. And there's a lot of different habits and practices that we can use to increase our resilience. One thing that I mentioned at the very beginning is reminding ourselves that we are all in this together. We're all dealing with this at the same time. Some are dealing with more challenges during COVID and isolation. Some are dealing with less, but we are all still facing this together. And really, there's nobody significantly that we can blame for starting this. It just happened. And so, it's easy to want to blame somebody for that. But ultimately, for resilience, it's important that we practice certain behaviors, and blaming other people usually isn't one of those. So some examples of resilience are to ask ourselves, when we're dealing with something negative, are there any other explanations for our feelings about what's happening right now? And an example of that could be when people are feeling depressed because of the isolation that we're going through right now, there could be additional explanations for why we might be feeling that way. I have patients sometimes that are going through a lot of understandable depressive symptoms because of this isolation, not being able to see people, not being able to have routines that they may have in the past. And some explanations for those people might be, example, when we don't get enough sunshine, we don't get the vitamin D, and that affects our energy level. It also affects our mood. There could also be other physical things going on. So it's important when we're feeling down to look at, are there any other explanations? Are there things that we can do to cope with this? The other thing is, what are the best case scenarios for this situation? What are the worst case scenarios, and can I live through it? An example of that might be knowing that we've already gone through 10 months of this isolation and restriction together, knowing that a lot of people, especially older people, are going to be getting vaccines soon or offered vaccines soon. We're at that point now where we're basically waiting for the rescue ship to arrive, which is we've been maybe stranded for a while, and now rescue is coming. And the question is, can we wait? And how do we wait through it while it's coming? How do we continue our stamina and perseverance while it's coming? And the best case scenario can sometimes be that whenever we have to persevere through something, it makes us stronger. Even when there's tragic things that can happen. I wish I could ask y'all questions, but I'm going to have to wait until the end. The next part is, these are some things that can help build emotional resilience. And I really like the journaling for a couple of reasons. Journaling is really good for helping our brain to let go of the negative thoughts and feelings that we're having. Whenever we're feeling things, letting them out on paper helps our brain feel like, okay, she's got this or he's got this, it's on paper. I don't have to ruminate about it so much. So it helps decrease the intensity of the emotions that we're feeling. The other thing is, it can be really helpful to have something that you look back on for posterity. Sometimes looking through old journals of people that have gone through things, tragic things like World War II, World War I, Depression, Great Depression, all these things, it's really informative and helpful to see how people coped with those things. And even looking back at our own experiences when we coped with difficult things can be a learning experience. So I think journaling is good for both of those reasons. Other things that are important are writing down goals for the day. Even if your goals might be, I'm going to go outside and get some sun, and I'm going to watch this certain show today. Sometimes just having a little bit of some structure, even if it's not too much different than your regular routine, but having some goals can help create some challenge, some hope for things that you want to accomplish. If you don't have any goals, think about the things you may have heard other people talk about that you thought about doing, but didn't have time before. I'm sure many people at this point in the game, after 10 months, have probably already improved their organization, cleaned their bookshelves, gone through old clothes, all these things that probably we had a lot of energy to do maybe at the beginning, and now we're just done. And that may not be relevant to you now. But other ideas for things that you may have heard people talk about and haven't done yet would be maybe reading a book that you've heard about and haven't started yet. Looking at old pictures, maybe looking at which ones you want to copy for other people. I have one patient that was taking this time to go through all her old pictures to kind of jot down things about each picture so she could pass it on to her grandkids. Anything that improves your sense of control over your house, which is like your nest, your home, is going to make a lot of people feel better. Whenever we can sort of gain some sense of control in these out of control times, it's going to help us feel better. Okay, next slide. Some other things that I want to make sure we focus on that are really important are behaviors like meditation and exercise. By far, the best way to improve your mood, comparable to taking antidepressant medication, is exercise. When we get 3 to 5 days a week of cardiovascular exercise, something that increases our variable heart rate, and variable heart rate is important because variable heart rate is basically meaning that you can make your heart rate go really high and then allow it to come back down. And the more we challenge our heart to do that, it strengthens our heart, but it also improves our mood because we're producing endorphins when we're exercising. And that is one of the best ways to improve our mood and reduce anxiety. So anytime that you can do something, and it might even just be a brisk walk when you get out in nature, that also helps, which I'll talk more about the next slide. But exercise is huge. So I will definitely be spending some more time in the next few slides on exercise. But I'm going to take a moment to talk about mindful meditation. This is the other really important aspect of dealing with isolation. Now, just because you're isolated or feel isolated doesn't mean that you're practicing mindfulness. That being alone doesn't necessarily equate to being in a meditative state. Meditation is any time you are focusing on one thing at a time without thinking about the past, the future, or analyzing yourself. When you're in your senses, whether it be sight, sound, smell, taste, touch, you're focusing and you're meditating. And so that could be staring at candles, looking at the light of the candle and trying not to think about what you're going to do tomorrow or what you're going to do afterwards, but just being in the moment and curious about what you're noticing. So for some people, practicing mindful meditation where you're just focusing without doing anything can be challenging. It is important to know that there are other activities that can be meditative without necessarily being quiet and not moving much. Things like jigsaw puzzles, coloring books, knitting, crocheting, cooking, like especially with chopping, just the mundane activities of washing vegetables, for example. Anytime you're focusing, but when you are doing those things, it's important to know that you could be washing vegetables or chopping and be thinking about what you're going to do after or what happened yesterday. That's not meditating. When you can focus on just the moment of what you're doing and not be thinking about the past or the future, that is meditating. And the reason that that's important is because it's strengthening the frontal lobe of your brain. And the frontal lobe of your brain is the part of your brain that can tune out negative emotions, can focus, can control impulses. So anytime you're meditating, it's going to strengthen that part of your brain that's going to help you cope with any other challenges emotionally that you may be facing. Okay, next slide. So exercise, back to exercise. So any activities that improve your variable heart rate. Now, some interesting activities that improve variable heart rate that don't necessarily have to be serious cardio exercises can be yoga. And the reason yoga is an example of some activity that improves your variable heart rate is because you might be in a body position in yoga where your breathing may increase and you're also focusing a lot on your breathing, and then you might relax afterwards. So variable heart rate is like you increase your heart rate and then you let it slow down, increase it and slow down. And that really helps with mood. It also helps with dealing with trauma. People that have a more variable heart rate are better able at coping with traumas and anxieties. So if, for example, you're able to go out on a walk, you might spend 30 seconds walking at a really fast pace, as fast as you can, and then slow it down and really walk slow for a while. And then speed it up again for 30 seconds and then slow it down. That would be an example of how to really work on your variable heart rate. So coping with being cooped up, kind of stuff we've talked a little bit about already, but the importance of getting outside, I cannot undervalue. When we're outside in nature, it not only do we get the sunlight, even though it's winter and there may not always be a lot of sun, any sunlight that we get is going to be helpful for our vitamin D. It's going to help with our mood. It helps with so many other body sensations and processes like iron intake, etc. But the other thing about being out in nature is that they've found when people walk in nature specifically, they get the ions that come off of trees and water and rivers and things like that, that also improve our mood. It kind of helps deal with free radicals. People, especially that are tending toward obsessive compulsive disorders or any other kinds of issues where you have ruminating thoughts or have a hard time getting out of your mind, nature really, walking around in nature really helps with that part of the brain. So getting outside is really important, not just the exercise part. But other things that I think are important is, once restaurants are open again, or even when they're not open, Maybe some things that could help would be just kind of having your wish list of things you want to try. Like I said, anything that you can look forward to, if it's trying a new restaurant, a new cuisine takeout, that might be what you look forward to for that day or that week. So anything that you can do that's something novel will kind of create some anticipation and some interest in things outside of our houses. Learning new hobbies, kind of what we talked about earlier. If it's not a new hobby for you to crochet, or if it is a new hobby for you, excuse me, to crochet or knit, that might be a good thing to consider learning. Because anytime you learn a new hobby, it creates new pathways in the brain. The other part about learning new activities is that whenever we learn something new, it could be something as simple as learning how to do Zoom. You know, we all had to kind of learn how to do Zoom at the very beginning of this pandemic. And that gives us a sense of mastery. Now, mastery doesn't necessarily mean you're like a master at doing Zoom, or like we would equate to like a chess master, but it just gives you that sense that you know what you're doing enough to do it. And that increases our self-esteem and our mood. It also gives us a sense of, oops, can you go back? It also gives us a sense of control over our environment. As I mentioned earlier, when we have some sense of control, it helps us feel better. And it's a distraction, honestly. When we're learning something new, we're spending time learning that new thing, and we can get some distraction from the monotony of the days that we have to deal with. So I encourage everybody, if you haven't already learned one, to maybe pick up a new hobby. Okay, next slide. Some other things that are kind of more mental ways to cope are taking time to think about other times in our lives where we've overcome obstacles, reminding ourselves that we can survive this because we've survived other things. I also happen to be a big fan of reading stories of other people, whether they be biographies or historical novels or fiction, historical fiction. Right now, I'm reading a book. If anybody hasn't read Ken Follett, I highly recommend him as an author. He talks about historical times in England, starting kind of with the medieval era and going all the way through the Cold War. But it's just really amazing to see and experience through these novels what other people have gone through. People when they didn't have indoor plumbing, or people when they didn't know where their next meal was going to come from, or people who took showers once a year. So I'm not a big fan of people saying, well, you know, when you're not feeling good, oh, you could have it worse. I don't think that that's helpful. I think, though, that when we do read about other people who do have it worse, not because someone's telling us to, but because it's just something of interest to us, I think it does help us appreciate where we're at now and how we will be able to overcome it because other people have done that. Okay. The other thing that I really want to focus on is that, of course, when you're feeling depressed or anxious, it might be temporary. It might be just a few weeks. It might be intermittent, like a day or two here or there. But when you're experiencing symptoms of depression, like having a change in your sleep patterns you're not getting enough sleep, you're waking up in the middle of the night, or maybe you're sleeping too much, or your appetite has significantly changed, or you're feeling really bad about yourself, or not feeling like you can concentrate, or even having thoughts of death, not wishing you were alive. These are examples. If you have these feelings for at least a couple of weeks, for most of the week, for those 2 weeks, would be a good time to consider getting counseling. There is mental health treatment available, whether it be via Zoom or even coming into the office. So that is definitely something that I want to encourage people to do when you need it. If you're not able or don't know if you need help right now, but you just want to check it out, you can always get on the wait list and try to get in when you need to, but you can cancel if you decide that you're feeling better. But I would definitely encourage you to consider counseling if your symptoms, your anxiety or depression symptoms seem like they're lingering for most days for at least a few weeks. And I'm happy to talk to you more about other symptoms of anxiety and depression if you need to. Courage doesn't, oops, sorry. The last quote I really like. Thank you for putting this together, my helpers. Courage doesn't always roar. Sometimes courage is the quiet voice at the end of the day saying, I will try again tomorrow. Thank you all for your time. I appreciate it. And here is a list of some resources for looking up some of the things I've talked about online. If you're not already connected with any kind of YouTube, definitely do that. You can look up almost anything on YouTube, from how to crochet and knit to yoga, mindful meditation, comedy shows. There's also podcasts. Dignity has podcast series that helps with people's stories of human kindness, and that can really make us feel good when we're going through what we're going through. Also, there's a group called Well Connected and Well Connected Espanol that can help with all kinds of educational stimulation, laughs, inspiration, conversation, and more. If you have any questions about these things, please send it via chat, or I don't know if we can print out some of these things, but we'll try to do our best to make sure people get what they need. Let me leave you my name and number just in case anybody has any questions for me personally. I don't mind people calling me. My name is Stephanie Parmely, and I work at Dignity Health in the behavioral health department. My phone number is, and you don't have to go through any rigmarole to get there. This is my specific landline that reaches me directly, is 916-357-6131. That number on that screen is the address, and it has the main office line. But my personal, not my personal phone, but my office phone is the 357-6131. And I have no problem with people calling me. You may not get me right away because I do see patients, but as soon as I can, I will get back to you. Thank you guys so much for your time and for letting me share this with you. I wish I could have seen your faces or been able to hear you, but I appreciate that I had the chance to do this. Thank you so much.
We appreciate you. Thank you so much.
So I think I'm going to take it back, and we will pick up where we left off.
All right, so I'll just pick back up. This is Michelle Lahuda again. Just to recap what we were discussing before our guest arrived. We were talking about Magellan Behavioral Health, which is the provider for your behavioral health needs under Western Health Advantage. There is no primary care referral required to seek access to a Magellan Behavioral Health provider. It can be for mental and substance abuse situations, if that's depending on what kind of care you need. And we had left off on about the importance of coordinating your care as a whole person. So if you are experiencing a situation mentally, you want to make sure that you're engaging your primary care in that, or vice versa. If you're having a treatment plan from your medical provider, let your behavioral health specialist know so they can ensure that they're treating the whole person. So speaking of depression, Magellan does provide 2 specific screenings to help patients combat depression. One program is for folks who have had a major medical event or a hospital inpatient stay. It's not uncommon for us, after we've had a health scare or we're suffering from potential chronic health issue, to get depressed after that. So Magellan actively screens patients after the event so they can help them to prevent further depression and give them the resources they need to help them. The second type of screening is for patients who are diabetic and might be having some issues controlling their diabetes, and coincidentally have had a heart attack or having issues with their heart, angina or a regular heartbeat. That patient is another candidate who might suffer from depression. So they screen for that so they can do outreach and engage the patient to help them control that issue. So Dr. Parmely talked about sleep impacting the stress of not getting regular sleep, whether you are sleeping, you fall asleep and then you wake up and you can't go back to sleep, or you can't sleep at all. Sometimes some people sleep too much. So Magellan has an application, a mobile app that you can get through the App Store or Google Play. It's called Restore, and there's no cost to this app. And what it does, it provides 6 sessions to help you change your behavior so you can start sleeping better. And then when we sleep better, we feel better, we eat better, we have the energy to go out and exercise, everything that Dr. Parmely had just touched upon. And the good news is they created this specifically for COVID, but we can use these same skills going forward for anything else that might impact our sleep. I mean, COVID's not going to be probably the only thing we have causing us stress going forward. Okay, but hopefully not as significant. So let's talk now how you find a Magellan provider. So in your welcome kit we mailed you, we included the phone number and the website information to access a Magellan provider. You can go direct to magellanfindaprovider.com/WHA, or you can go to Western Health Advantage website. The benefit of using your WHA account, our member portal, is it gives you single sign-on to the Magellan website to find a provider. So I really encourage you to make sure you have that WHA account. All right, so the next slide here, this is a picture of our provider search on our website. So when you get to this screen, mywa.org, search a provider, find a doctor facility, and on the right-hand side, it says behavioral health provider. And when you click on that, it will take you directly to Magellan's site. And our next slide depicts that view. And as you can see, so at the top, where it says WHA Medicare search, you would select on that, and this is the screen that will pop up. So you can provide a provider. You can do it by location. You can, if you're looking for a specific provider, you can click on that tab and put that doctor's information in. You have all sorts of filters. You can, language, location, the type of provider you're looking for. So you can do several searches and narrow it down depending on what you're looking for. And then you can contact, very important information I should tell you, once you select a provider, you contact that provider directly and make an appointment. Sometimes that you would have that discussion, that provider would like to have a discussion with you about what's happening or why you're calling to make an appointment. And then the two of you can decide if that provider is the right fit for you. So Magellan also offers a wealth of resources. So it's more than, their website is more than just looking for a provider. So you can go to this website, magellanhealth.com, and oh, I'm sorry, Denise, are we going? Okay, okay, sorry. And then
I apologize.
So this is what the homepage looks like. No, that's okay. And then you can register, create an account, which I would encourage you to do because then that gives you easy access to all the resources they have, or you can enter as a guest. And the next slide shows what that looks like. When you enter as a guest or to register, what it asks for is your health plan's phone number. You don't have to remember the health plan's phone number because you can drop down here on, excuse me, enter your organization. And I just had started to type Western, but I stopped because look, all the Western Health popped up and Western Health Advantage Medicare. There you go. You would select on that, and then that will get you in as a guest, or you can register and create an account if that's your choice. So our next screen depicts once you're in the tool, all the resources that are available. So an array of topics. You can, emotional wellness, fitness, sleep issues, goal setting, and Dr. Parmely talked a lot about that today, which is very important and not I knew for myself, I don't do enough, but it is a very good thing to do. Just overall mind, body, and health. And if you're dealing with something specific like breast cancer or heart health, those resources are there too. So I just really would encourage you to, even if you're not at this moment in time needing the services of a Magellan health provider, I would encourage you to create, or at least visit the Magellan Healthcare website to look at their tools. I think they provide so many resources, also with COVID, that are just good for our daily living. Some of them we know, some of the times we just need a gentle reminder. So I think that wraps it up for my portion. So Denise, I will be glad to pass it back to you.
Great, thank you so much. And again, thank you all for your patience. But I hope that you're getting value out of this presentation. I know I've learned a few things. But we want to remind you, as Michelle said, make sure, if you haven't done so already, establish your MyWA account. That's very simple to do from our website. You go to the mywa.org MyCare login page, create your login, and that is your single point sign-on, and where it'll give you access to the links to the behavioral health or any of the other many benefits that are available to you as a Western Health member. If you need assistance with that, please feel free to give us a call and we'll walk you through it. Okay. Let's see here. So we want to remind you that we do have some additional webinars coming up. This Thursday is going to be an exciting wellness webinar featuring our resident expert, Alicia, and she'll be going through the wellness tools, resources, and the Nurse 24 for us. And then on February 2nd, we'll be going over how to, assess care through routine clinical, emergency, or urgent cares. And then on February 4th, we're going to be doing an overall recap of our previous webinars. So we definitely hope you join us for that. Thank you again for joining us. If you have any questions, please feel free to give us a call. You can also contact our Medicare department. And again, thank you so much for your time. Have a wonderful day, everyone.